On behalf of the College of Registered Nurses of British Columbia, thank you for joining us this evening. We hope you've enjoyed this year's Nursing Excellence Awards ceremony. But before we say goodnight, we'd like to take this opportunity to look back on the rich history of nursing in this province, and also to look forward at where we're heading. Over the years, the Graduate Nurses Association, the Registered Nurses Association, the BC Nurses Union, CRNBC, the BC Nurse Practitioner Association, and our community's newest entity, the Association of Registered Nurses of BC, have each played an important role in the shaping of nursing in the province. I'm delighted that my counterpart from the association has joined me. Joy, a very warm welcome.
Thank you, Cynthia. As the new Executive Director, I am proud and honored to represent the association tonight. The collaboration between us and the support of numerous nurse leaders over the last decade has resulted in a flourishing professional association for BC nurses. I'd like to take this opportunity to thank the members, staff, and boards of both the association and college for their efforts to date. Tonight's recognition program continues a proud tradition started in 1971 to recognize excellence in the nursing profession.
In 2012, we celebrated the 100th year of nursing as a self-regulating profession in British Columbia. Nursing has a proud history in our province. In the early days in Fort Victoria, nurses were often the only healthcare available for our small population of First Nations, trappers, fishermen, miners, and loggers. Our first hospitals grew from these first nursing stations: the Royal Hospital, now the Royal Jubilee, the Royal Columbian Hospital, Vancouver General, and St. Paul's Hospital.
At the time, hospital-based education programs were the norm. Education was totally different then than it is now. Nurses often lived in residence and provided hospitals with inexpensive labor while working in very difficult circumstances. As a result, nurses and nursing students recognized the need for support and oversight of the profession, and the Graduate Nurses Association was formed under the guidance and stewardship of iconic nurses like Helen Randall.
From 1912 to 1934, the Graduate Nurses Association worked to improve and expand nurses' hospital education and fought for standardized education exams and recognition. They succeeded in convincing the government to establish a statutory framework for the regulation of nursing in the province, and in 1935 officially became the Registered Nurses Association of British Columbia, or ARNBC.
ARNBC focused on the regulation of registered nurses, but also worked to broadly influence the healthcare system. In fact, ARNBC played a key role in positioning the primary healthcare agenda in the province. ARNBC was committed to upholding the integrity of the nursing profession and supporting nursing's contributions to the health and welfare of the people of British Columbia.
In 1980, the RNABC ceased responsibility for labor relations and the BC Nurses Union was established. RNABC went on to adopt a regulatory framework for promoting high practice standards, supporting nurses to reach those standards, and intervening when practice was unacceptable. In 2005, changes to the Health Professions Act were enacted to bring the regulation of registered nurses and nurse practitioners in line with other health professionals. The changes resulted in the dissolution of the RNABC and the creation of the new College of Registered Nurses of British Columbia.
Once regulating in the public interest was the focus of the college, the voice of nurses in the development of health, nursing, and public policy was lacking. In 2010, the Association of Registered Nurses of BC became an incorporated body, established to assume the role of enhancing the nursing profession through advocacy and influencing policy. All RNs and NPs in the province are members of ARNBC, and through this membership, they're also members of the Canadian Nurses Association.
At CRNBC, we are continuing to realign our responsibilities to meet our regulatory mandate. Our two organizations have been working collaboratively to make sure our individual mandates complement and support each other, as well as nurses in this province. And this collaboration has already yielded results. This year we signed a fee collection agreement, meaning that in 2015, RNs and NPs will only have to pay once for registration, renewal, and association fees. I'm also pleased to tell you we will be transitioning the awards program to ARNBC in the next 12 to 18 months.
As a profession, when we look back over the last 100 years, we can be proud of what we have accomplished and what we have to look forward to. This year's awards program recognizes 36 exceptional nurses. Thank you to all who nominated your colleagues, supported your employees, and enabled innovative nursing programs within your organizations. We celebrate BC nurses for their compassion, dedication, and integrity. Thank you for all you do to support British Columbians. We'll see you next year at the 2015 Nursing Excellence Awards.